Duloxetine was marketed under the brand name Cymbalta. It's classified as a selective serotonin and norepinephrine reuptake inhibitor, or SNRI. Duloxetine is indicated in Canada and the US for the treatment of major depressive disorder, generalized anxiety disorder, diabetic neuropathic pain, fibromyalgia, chronic low back pain, and osteoarthritis of the knee. The recommended dose of duloxetine for depression is 60 milligrams, and the recommended dose for anxiety and most pain conditions is up to 120 milligrams. However, some experienced prescribers will use off-label doses that exceed 120 milligrams if, following each dose increase, the drug is well tolerated and the higher dose offers further benefit. It's important to note that the norepinephrine effect of duloxetine is not usually clinically significant until it is titrated to 90 milligrams or more. Duloxetine may be initiated at a dose of 30 milligrams, although the recommended starting dose is 60 milligrams. Starting lower and titrating more slowly is appropriate for patients who have significant anxiety symptoms and might be more sensitive to early side effects, or for the elderly, or anyone really that you're concerned are more sensitive to early side effects. When titrating, wait a week or more, depending on tolerability, before increasing the dose from 30 to 60 milligrams. If necessary, the dose may be further increased by 30 milligram per day increments, no more rapidly than every 2 weeks. If there are early side effects, don't increase the dose until they're fully resolved. Lowering the dose by 30 milligrams might lessen the side effect, and then the dose may be increased again once the side effect has fully resolved. It's important to treat mood and anxiety symptoms completely because residual symptoms of depression like fatigue, low energy, or cognitive impairment reliably predict relapse. It's also important to fully optimize the dose while ensuring the patient is benefiting from the treatment and tolerating the dose well. Full functional recovery should be the ultimate goal of treatment. Duloxetine may be taken in the morning or in the evening. If initiated in the evening, some patients will sleep through those typical early side effects like nausea or headache. If a patient is concerned that the duloxetine is having a negative effect on their sleep, they should change the dose to breakfast time. Duloxetine may be taken with or without food. However, a common early side effect is nausea, which might be reduced or eliminated if duloxetine is taken with food. While early nausea is not uncommon, for most patients it is mild and resolves within 1 to 2 weeks. It's best not to increase the dose further until the nausea has fully resolved. The most common adverse effects associated with duloxetine include dry mouth, headache, nausea, and hyperhidrosis, or excessive sweating. That excessive sweating can be very bothersome, particularly in the summer months, and sometimes requires a switch to another antidepressant or the addition of a treatment to manage the problem. Weight gain is unusual for duloxetine, however, sexual dysfunction is not uncommon. Discontinuation symptoms are possible with all antidepressants, but are not common with duloxetine. However, urge patients who are discontinuing duloxetine to do so slowly over several weeks. If switching to or from another antidepressant, please see the SwitchRx antidepressant overview pages for details. Duloxetine has no known risk of QTc prolongation. As with all antidepressants, use caution if you suspect or know that your patient has bipolar disorder, to avoid the risk of provoking hypomania or mania. As for special populations, duloxetine is not recommended for patients with hepatic impairment, severe renal impairment, or end-stage renal disease. Monitor blood pressure and heart rate periodically in patients with hypertension or a cardiac history. No dose adjustment is required for the elderly, who usually require the same doses as younger adults. Starting lower and titrating more slowly is always a reasonable approach. For children and for adolescents, as with other antidepressants, careful evaluation of risks versus benefits and close monitoring for changes in behavior, especially suicidality, is highly recommended.